Hi everyone, I did my seminar paper on professional boundaries in nursing. So today I will discuss about this topic briefly in the next few slides. The objective of this presentation is to understand what is professional boundary and what are some action that causes professional boundary violations and how these actions impact on patient care and nursing profession, and some tips on how to maintain healthy boundaries in professional work. So this is just a picture I put in, but this is not clearly how professional boundaries are being met at hospitals or healthcare settings. Let's go to the next slide to see how professional boundaries are defined and what they are actually. So what is professional boundary? By definition, it's the limits that allow a patient and nurse to connect safely in a therapeutic relationship based on the patient's need. So it's really basically a safe place for a patient, because as we know, whenever a patient is seeking care, they're at a vulnerable stage and the nurse is in a stage of power. So to balance that, it's like the professional boundary is that safe place for a nurse to practice and a patient to receive care without being harmed, and actions that are potentially helpful, they're aligned with care plan. Any actions we do as nurse, will do as nurse are we are open for discussion, are within the limits of professional boundary. So these are some examples of what are some healthy boundaries. It is really important to understand what are healthy boundaries to distinguish what are boundary violations. So healthy boundaries are framework within which professional nurse and patient relationship occur, and it is those limit that makes the relationship safe, and it makes the services valid for a patient and for a nurse to give and a patient to receive. As I was researching for the seminar paper, I have seen these parameters so many times that I have to add it to my presentation, and it is the continuum of professional boundaries. So this really sets up the standard for a nurse to see where they are as a professional. So we can see there is the middle zone where it says zone of helpfulness, and on the right side there is the under involvement, and on the left side is the over involvement. So if we talk about the under involvement, it's like a nurse is distancing, neglecting a patient, and on the over involvement side is where all the boundary crossing on the all the boundary violation happen because a nurse is over involved with the patient. It can be being too friendly, it can be exchanging money or gift, and it can even be sexual misconduct. So we really have to if we look at this diagram, we can really see nurses relationship. Is it is staying within the zone of being helpful professional, or someone is being over involved, or someone is being under involved. So let's talk about why it's important to maintain boundaries. It is at a healthcare setting, nurses should absolutely maintain boundaries because, like we discussed, it is for public safety. Uh, when someone is maintaining the boundary, when healthcare professionals are maintaining their boundaries, they are actually keeping that patient safe, and they are going by the code of ethics, like they are respecting their right, the patient's right, they are causing no harm, they are being conscious of their need, and above all, they are meeting the needs of the patient instead of meeting their own need. So when someone is seeking care at a hospital or a healthcare setting, they are seeking care to be treated justly, fairly. So that's our priority as nurses, when we become nurses, to make sure that nurses needs are being prioritized, not healthcare professionals need. So let's talk about boundary violation. By definition, boundary violation is action that actually cause harm to patient or the family member or even the nurse or the nurse practitioner. So some examples of boundary violations, it can be physical neglect, it can be sexual abuse, it can be emotional or financial exploitation of the patient or the patient's family member. So I put in some examples of blurred professional boundaries with patients that we might encounter in our career. And the one that really came up in my research for this paper was not being friends with the patients. Sometimes we can become very nice and friendly, but we have to make sure that we are not becoming friends with the patient, because then it creates an expectation. And think about it, if you become friend with someone and if you don't give the time, or if you don't meet their expectation, it creates a really situation where the patient can be upset with you. It really can change the perspective of their setting and the dynamic. So it's really important for the nurse to make sure they are not becoming too involved with the patient. They are keeping that professional friendliness in place when interacting with the patient. This is the same concept, it's like emphasizing on not becoming too emotionally invested with the patient, because it can really create some misunderstanding and over expectation from the patient side, and that really can jeopardize the care they receive in the healthcare setting. Also, we have to keep in mind that a nurse should not be oversharing or disclose any personal information with the patient. I have a video later in the slide that really discusses why it's important for nurses not to share their personal information, because that puts a patient at risk for some situation, like unexpected situation. It puts them at a vulnerable stage if they are sharing their personal information with the patient. So we have to not only think about the safety of the patient, we also have to think about safety of us when sharing information. So it goes both ways. So whenever a nurse is in dilemma, that if they are in the verge of boundary crossing, or they have some concern about boundary issues with patient, these are some questions they can ask, for a self-assessment, to make sure they are not crossing any boundaries, or they are not doing any violation with the patient. For example, asking questions whose needs are being met, or is this my client's best interest, or even discussing any concern with the manager or the preceptor, I'm having this boundary issues with my patient, really helps navigate a nurse through to make professional boundaries healthy boundaries. So whenever a nurse is going through any dilemma about boundary crossing, these are some tips for them, like just to reassess and see if there is anything they can improve, and always being aware of their behaviors, being observant of the behavior of other colleagues, and always thinking the best for the patient, and intending no harm really helps keeping those boundaries straight. So next, in the next few slides, I have some questions to make sure I have delivered the message properly to you guys. I'm just gonna ask the question and see if you guys can answer them for me. The first question is, when referring to the relationship between nurse and patient, the boundaries are, if you could guess, A, B, C, D. The right answer is the limits that define the nurse and patient. As I discussed earlier in the slides, that boundaries, professional boundaries, are the limits that define the nurse and patient relationship. The second question for you guys is, boundaries are essential to protect clients from the nurses. A, B, C, D. Correct answer would be power, from nurses' power. The last question of this slide is, which one of the clearest sign that boundary violation has occurred in the nurse-patient relationship? And if you could pick from these four answers, A, B, C, D. So answer for the question is, the needs of the nurse are being met. So whenever the needs of a nurses are met, that's when the boundary crossing is happening. I thank you all for listening to my slides. If you have any question, please feel free to ask. Thank you.